6:05. So as people are coming in, let's just get this kicked off and going. Hello and welcome to the Pennsylvania Advocacy Project Town Hall. For you in attendance and the million not zooming around the world, let's have a town hall. And my name is John Fabizeski. I'll be the host this evening. On behalf of the Recovery Advocacy Project, we'd like to thank you all for your attendance in this discussion on the impact of COVID-19 on the recovery community and where we go from here. So we'd like to take a moment to introduce the team here at RAP, and beginning first with our regional lead, Tanya Harris. Tanya, if you take a second to introduce yourself.
Hi, everybody. Tanya Harris, Region 3 lead, here tonight with the PA state leads, bringing you town hall discussion on the COVID-19 and, you know, as it relates to providing services and to each other for today's discussion. And I'm just grateful everybody is here, and I look forward to hearing more about where everybody is at and how people are feeling and some of the ways that Recovery Advocacy Project could support initiatives moving forward. Thank you, John.
Thanks, Tanya. And now I'd like to introduce our state leads. Jessica DeVita, would you take a moment to introduce yourself?
Hi, my name is Jessica DeVita. I'm one of the PA state leads for the Recovery Advocacy Project. I'm from Pittsburgh, PA, and thank you all for joining us tonight. I look forward to listening.
Thank you, Jess. And Scott Tyre.
Hi everyone, I'm Scott Tyre. I'm from Lancaster, Pennsylvania. I just want to say thank you all for taking time out tonight to join us. And please feel free, again, as John's going to point out, to comment, question in the chat box, bring up anything that's on your mind, playing on your heart, happening in your area. And again, thanks for being here.
Thanks, Scott. It's now my privilege to introduce training lead for the Recovery Advocacy Project, Aaron Kacharski, the man who wears the best hats ever. Aaron, if you take a minute to explain RAP and take it away.
Thank you, Johnny. My name's Aaron Kacharski. I have been doing grassroots organizing for the recovery community for different organizations for years and years. And I was attracted to the Recovery Advocacy Project because it was a bit different in terms of philosophy of how, you know, who we're empowering, what we're working on. I think a lot of times, you know, I think of Recovery Advocacy Project as a project and almost less of as an organization, because it's all about building the grassroots capacity, transferring organizing skills, grassroots organizing skills, tools that we have to help organizers on the grassroots level. And I think for a long time, you know, if you think about national organizations, it's been the opposite of that. You know, there's a lot of times there's an organization that kind of comes and they're like, this is what everybody's working on. And that doesn't always translate to what's happening on the ground, the reality of what's happening on the grassroots level. And so the Recovery Advocacy Project in Pennsylvania looks different than Recovery Advocacy Project Alaska or Mississippi or Rhode Island or California. And it should, because we have different issues that people are working on. We're working to listen to as many people as recovery as possible. In Pennsylvania, it's unique because Pennsylvania has a number of great advocacy grassroots organizations that already exist. It's not like that in every state. And so one of the things that the state leads had talked to us about, they said, hey, you know, we want to make sure that people understand what Recovery Advocacy Project is, because it's not like an organization trying to compete with what already exists. Our mindset is that we want to empower the individual grassroots advocate, so that way organizations have a stronger base of grassroots advocate. People, you know, the power is transferred on the grassroots level. And we're doing that a number of different ways in terms of tools that we're providing for people. We have an advocacy guide at recoveryvoices.com that is very helpful for people. There's a lot of how-to sort of manuals of if you want to learn how to speak out as a recovery advocate, as reducing stigma, there's a how-to for that. If you want to learn how to plan a town hall, there's one for that. How a bill becomes a law, all these different sort of community organizing how-tos. We're working to publish it. And if you go to the website and there's something there that you don't see, let us know and we'll work to write a guide for that as well. And then the other piece that we want to put in the hands of organizers to think and act locally in Pennsylvania is a platform called Action Network. And it's really like a campaign builder. So if you're an individual or an organization that wants to put together a petition against your local zoning board because they're not allowing a detox, for example, or recovery houses, or if you want to do a statewide letter writing campaign to elected officials on a bill that's important to you in your community, Action Network allows you to do that. And so one of the things that I like to think about in terms of Recovery Advocacy Project is that I've been doing grassroots work in New Jersey and other states for years and years and years. And no matter how hard we try, there's always people that fall through the cracks. Somebody that gets involved with something and then isn't engaged. And I think that Action Network and Recovery Advocacy Project fixes that. And the state leads in Pennsylvania are doing a great job in terms of working to develop both community and legislative-based solutions around some of the common barriers and experiences that people are having in recovery in Pennsylvania. I used to live in Pennsylvania. I did a lot of work in New Jersey. We ran some advocacy teams in Pennsylvania. It kind of overflowed. And so I've worked with, beside, and for a number of people on this town hall. So it's good to see a lot of familiar faces, and it's good to see a lot of new faces. I'm going to turn it back over to the state leads. I'm going to put 2 links in the chat box. The first is a Google form that just allows us to, we want to know more about you, about the issues that you care about in your community. So I'm going to put a link to a Google form in the chat box. And then I'm also just going to put the Recovery Advocacy Project website if you want to take a look at the advocacy guides and the how-to manuals. Thank you very much, Johnny, and the other state leads. We wanted to get out of the way and let you guys just go ahead and do this and rock out in Pennsylvania. So I'm going to pass it back to you guys.
Thanks, Aaron. And you're right, we have a strong recovery movement here in Pennsylvania. And the panel that we've assembled this evening are true stewards and most of mentors to myself, to the movement. The panelists are going to take a few minutes to make introductions and discuss their organization mission. Tonight we'll start with Devin Reeves of the Pennsylvania Harm Reduction Coalition. Devin?
Going first, you got me shook here. Hey everyone, my name is Devin Reeves, the Executive Director of the Pennsylvania Harm Reduction Coalition. I guess the first thing I want you to know is that I'm a person in recovery. I struggled with drugs and alcohol, and due to an abundance of access of resources, I was able to begin and sustain a journey to recovery that brought me all over the East Coast and really let me see that not everybody had the opportunity I did to recover and to thrive in recovery. And because of that, I started an organization called the Pennsylvania Harm Reduction Coalition. Our goal is really to increase the knowledge and capacity of those impacted by social inequity, criminalization, and stigma, educating key decision makers on effective policy, and really pushing them to do something about that, and building community power and leadership through training, outreach, and engagement. We're on social media. Feel free to check us out. The Pennsylvania Harm Reduction Coalition, we're about harm reduction. A lot of people don't know what harm reduction is. Super quick, harm reduction is any intervention that mitigates the dangerous behavior, right? So we know that driving your car could be really dangerous. So what makes, driving a car less dangerous? A seatbelt, airbags. Having sex with somebody can be, a place where you can get an STI. And wearing condoms is something that makes that safer. And when it comes to using drugs, harm reduction is things like naloxone and syringes, because you don't want people getting HIV or hepatitis C or soft tissue infections. And those are some of the things we focus on as the harm reduction, coalition. And in broader, we have really succinct goals. We want to reduce overdose deaths in the state of Pennsylvania amongst people that are most likely to overdose. So the group that is, most likely to overdose is really people that are getting out of jail or returning citizens. We have a campaign called Serving Returning Citizens, and we want to make sure that people are getting quality treatment while they're incarcerated, and that when they leave treatment, when they leave incarceration, they're getting a dose of naloxone, because people leaving incarceration overdose at 50 to 120 times that of the general public, which is terrible. Also, we're doing a lot of work around syringe service programs. So that's our PASS campaign. We know that syringe service programs are one of the best ways to engage people that are using drugs right now, as opposed to sending cops out and things like that. And this is a great way to get naloxone in the hands of people that need it. It's a great way to engage people in treatment and recovery. And also, it's just a great way to make sure people don't get HIV and things like that. And we also think our treatment centers can be a better tool to prevent overdose. Anybody that's taking opioids for a period of time and then stops is at an increase of overdose. And if treatment centers did little things like gave out naloxone, taught people, if you don't mix drugs, you're less likely to overdose, your tolerance is down. And so those are some of the things that we're working on. And during COVID-19, we picked 3 goals to work on. We wanted to decrease the justice-involved population to minimize the risk of an outbreak in jail. We did a really good job with that in some places as a state. Other places we failed miserably. Other places did really well, but they did it very quietly. And we also wanted to make sure people got naloxone as they were leaving prison and jails. We wanted to remove barriers to medications for opioid use disorder, because we knew that, and other treatment options, because we knew that the drug supply was going to get squirrely because what was happening with COVID-19. We wanted to make sure that people could get access to treatment, whether that was Suboxone, methadone, residential treatment, outpatient treatment. We wanted to make sure that the state was doing and agencies were doing what they needed to respond effectively. And then also, I think that we didn't do a great job on this one as a state, ensuring that the needs of people experiencing homelessness are included in the pandemic response. We think that, in Philly, we saw a lot of things that we didn't appreciate. We were able to work with a lot of other advocates to make sure that we stopped arresting people that were homeless. We stopped putting them in places they didn't want to be, because, we saw in other cities like Boston, where there were outbreaks amongst the homeless population, and a lot of people ended up dying. Another cool thing we did during COVID-19 is we launched or really stepped up our naloxone distribution program. So as of 5/12, which is, God, forever ago now, we distributed 7,500 doses of naloxone in 52 counties, 27 doses to individuals, 60 community-based organizations, and we got 32 county jails to start naloxone distribution. So if you live in Susquehanna, Carbon, Clinton, Clearfield, or any of these lame gray counties we haven't sent naloxone to, and you know an organization that could distribute naloxone, or you know somebody that needs naloxone, definitely check out our website, paharmreduction.org/naloxone, and we will send you, a loved one, or an organization to distribute naloxone. Our theory of change is simple, much like the Recovery Advocacy Project, and really a lot of what we created, I copied of what Aaron did in New Jersey. So our theories of change are very simple. We believe it's a 3-step process. We have to identify people that give a shit. We need to educate them on what the problems are, what the solutions are, and then we want to activate them to, be part of an advocacy team, engage a legislator, be a voice of change. And a lot of the resources that Aaron talked about, we use with our own advocates. I mean, there's really not a lot of difference. It's just got to get engaged, right? There's nothing special about what we do. I just want to point a quick action alert. If you follow Johnny Fab on Facebook, there's a bill introduced in the House and the Senate, or a co-sponsored member in the House and the Senate, to legalize syringe service programs. I can talk some more about that, but I don't really have the time. We think this is an awesome thing. Maybe you saw some of Johnny's videos. It's super easy to do. Go to PA Harm Reduction/SSP bill to check that out, to learn more. Thank you.
Wow, Devin, thank you so much. It's been awesome to kind of come up and watch you grow and be part of that, and definitely see what you're doing. And it's great to have you here this evening. And you can take Susquehanna County and you can make that not gray or lame, as you had put it. because a lot of the distribution you sent to me, some of that went to Susquehanna County indirectly. So you can shade that in. Thanks a lot, Devin.
I will update.
Next we have,
John.
what's that?
I will update. I will update.
Next we have William Stauffer of the Pennsylvania Recovery Organizations Alliance. Bill?
Uh-oh.
Did we lose Bill?
Bill, you're on mute, brother.
Bill, you're on mute. I'll take you off mute. Hold on, I got you. Go ahead. No.
Uh-oh. Negative.
He's got like a phone symbol. Are you called in, Bill? Are you on mute on your phone? No.
Well, while we figure out
Can you hear
Bill's
me now?
technical issue.
Yes.
Oh, there we go. Go ahead, Bill.
And it's gone again.
Wait. How did that happen? All right. Next introduction.
Okay.
Yeah, while we figure
Hey,
Yeah, he's back.
All right, you got it, Bill.
thank you all very much. Thank you, Devin. And Devin's doing great work around harm reduction. And if you ask him, I'm sure he'll tell you that PRO-A, the organization that I represent, was the first supporter that Pennsylvania harm reduction had in the state of Pennsylvania. So my name is Bill Stauffer. I'm a person in long-term recovery, which means I have not had to use a drink or a drug since 1986. I joke that I'm a formerly young person still in recovery. I've spent most of those 34 years working around our care systems in all kinds of different capacities. For since 2012, I've had the great honor of being the executive director of PRO-A, Pennsylvania Recovery Organizations Alliance. We are the statewide recovery organization of Pennsylvania, and I see Donna Dimitrovic, our first executive director, is on this call. So what we do is we advocate for persons with addictions and in recovery to get services that they need. We educate the public about substance use disorders and about how recovery is all around them, and we are valuable members of the community, and we mobilize people. We've done that in a number of ways over the years. First, I want to talk a little bit about the recovery movement. And so when I walked into care in 1986, everything that I got came from people in recovery. My lesson in learning about substance use disorders and our care system is everything that we have came from the recovery community. There was nothing in the mid-1960s. Everything came from us. And so the power of people in recovery to come together to provide services and get people organized so that we can care for each other is paramount to what we do. And we also see examples of our systems becoming over-professionalized, marginalized, and co-opted, and we really have to watch those things. So what we have done over the years is we developed the CRS, the Certified Recovery Specialist Training, with the grassroots recovery communities around Pennsylvania. We have been the largest trainer for that. We helped develop the Certified Family Recovery Specialist Training. We developed the core competencies around peer services. So we really made sure that individuals in recovery are in our workforce. I have grave concerns about where that's going now, as our systems are moving away from having that administered by the recovery community and into other groups. And that's something that we're going to need to advocate for. We've been involved in advocating for adolescent care, had a hearing last year in the Pennsylvania General Assembly about an abysmal lack of care for young people in our systems. The need and advocating for long-term care, the collegiate recovery, recovery high schools, peer support services, and making sure that we have a full continuum of care, not just for adolescents, but for everybody. We've had the opportunity to advocate for the needs of older adults in the U.S. Senate. In recent weeks, I've had the opportunity to work with a writer by the name of Bill White to talk about how do we model recovery and be servant leaderships. On this call, it's a privilege to me to see sometimes we lead from a servant mentality. So I see people on this call that we've helped sort of nurture their community organizations. So we help nurture recovery community organizations and local communities. And so there's people on these calls that are on my speed dial, which is why we may not always be out front, but what we're doing is building recovery in communities. And I will put our website in the message box so you could learn more about it. But I want to say, when I talk about the history of recovery, is that we're in a really important time. And if I'm talking about Pennsylvania, there was a famous Pennsylvania resident, guy named Benjamin Franklin. And Benjamin Franklin said, "We must all hang together, or we shall all hang separately." And if you look at the history of what happens around addiction and recovery, is when we all come together, we're able to achieve things. When we divide, and we are also known for doing that, into little factions, what we do is it destroys us. And there is tremendous stigma out there who are just kind of waiting for those things to happen. So I'll stop here. I know we have some time for some questions and answers, and thank you all very much for having me here tonight.
Oh, you're muted, Johnny. There you go.
Thank you, Bill. Another steward of recovery and mentor. Just taken back this evening listening to you guys speak, and to have the opportunity to be where I am asking you to, help in some way or assist in some way is just, it's astonishing, the gifts of recovery. And finally, our last panelist, before we move into the questions, and we have some other speakers a little bit, but Jennifer Colon from Recovery Community Connections.
Hi, everyone. Hi, Johnny. Hi, Bill. I see all the hands that have kind of helped us along the way. My name is Jennifer Colon. I'm a person in long-term recovery from substance use and mental health disorder. I'm the executive director and founder of Recovery Community Connection in Williamsport, Pennsylvania. We're a recovery community organization founded on the idea that there were some challenges and strengths in our community, and that there was a place for an organization made up of individuals and family in recovery to promote recovery and engage the community in the idea that people do recover and thrive. When we got this thing started, we really had, where do we start? There's so much. There were so many barriers and challenges. And one of the things, one of the benefits of being a person in recovery was that, we are navigating, these clinical and non-clinical supports. So we know, what's there and what needs to be fixed and what could be added. So one of the things we saw, if we really wanted to, get our foot in the door and get started, we need to have a variety of different mutual aid support groups. And I had the privilege of under some very interesting circumstances, experiencing an RCO in Rochester, Minnesota. And I mean, this was an amazing place. I just, they had all these great things and different support groups happening. And I'm like, are we allowed to do this? Because I had been brought up, it's 12 steps, you got to do this way. And then I get there and there was just this immense freedom, and they're learning about advocacy and learning that I do have a voice and that we do recover and thrive. And, so we started there in our community in Williamsport. We began to mobilize these support groups. We started first with a Women for Sobriety support group. It was a new idea, these things weren't in our community before. We brought in an all recovery, Cocaine Anonymous. We brought in a smart recovery, and that took a little bit, but then the benefit of having that support in the community started to be realized, and now we see it spreading a little bit. Currently, we were providing some informal peer support, working with ProA, learning exactly what our place is in the scheme of things. We're currently working to formalize our peer support program, as a billable service, yet maintaining our, our authenticity of voice and, kind of using the CRS, the non-professional resource professional yet non-professional to reach individuals that might not otherwise engage with, say, a treatment provider or you know, the single county authority, but yet still being willing to work with them, with individuals. It's a very unique position that we're in right now. We're very humbled and honored to be in that position. It's been a challenge to kind of get you know, sort of a handle on where exactly we should focus our efforts, but nonetheless, we haven't given up, and just working with ProA and other advocacy groups across the state. I mean, it looks like, you know, our voice is needed. It matters. You know, we're making a difference. COVID-19 has really kind of stopped everything. We really felt as an organization, we just didn't have enough, you know, information on this illness, and we really wanted our individuals to be safe. So we've transitioned our support groups to Zoom and kind of slowed things down quite a bit. But we're very glad to be a part of this this recovery movement. I often think to myself, and there's a couple of us, what an amazing time to be in recovery. Just I came into recovery in 2012, and I mean, it just, everything was about timing. I never knew about a recovery movement. I have a voice, can you believe that, you know? So I'm super excited to be a part of this whole advocacy movement. I couldn't imagine being in recovery at another time in my life at all. So everything is what it is, as they say. I'm grateful to be here, guys. I'm glad to see everybody here. Bill's here, Devin's here, Johnny Bab's here. This is great stuff. Thanks, guys.
Thank you so much, Jennifer. And thank you all for being, you know, blessing in my life and part of my life. All three panelists this evening are, the three of you have some way connected or stewarded my journey along recovery, and I thank you for being here. So we will begin posing questions to the panel. These questions came at the time of registration. When you registered, you were asked questions, and we put together those first two questions based on your responses. And what we encourage is during those questions, after those two questions, we'll have two other speakers, and then we will take your questions from the chat. Our state leads will pull your questions from the chat, and then we'll ask the panel. So at this time, I'm going to pass it off to Scott Tyre to take the first question for our panelists. And panelists, please just chime in, let us know who wants to do it. Thanks.
Okay, the first question. The pandemic has brought a significant amount of new challenges for people still using substances and in recovery. What are some of the ways your organization has adapted in assisting to build resiliency for our community?
Scott, I'll start if, can you hear me?
Sure, Bill.
Okay, so, you know, it's taken a hit on the recovery community because connection is critically important to people in recovery and seeking help for a substance use disorder. And so I think a lot of us, and including at ProA, we sort of jumped into action. And I think one of the greatest untold stories so far is how many individuals and grassroots groups came together and put our whole world online. The whole recovery world went online overnight because people jumped into doing that. We put together and continue to host weekly calls, bringing people together Tuesday at 10 a.m. across Pennsylvania to sort of collaborate and hive mind situations that the community is experiencing and figure out how to solve. So, for example, we had groups in rural communities who couldn't connect with online support. So other groups and individuals identified where we might be able to get resources and had county commissioners come in and support getting phones and materials out to individuals who needed that. We've had groups get food out for individuals. We've identified that isolation has been a severe problem, and making sure that individuals knew how to support people in recovery who might be too isolated. We've problem solved how to have social distancing meetings out in parks. We've supported providing peer services online using best practices that we've developed and actually had an opportunity to publish a paper with Bill White on. And we've also educated policymakers about the impact of all this on the community. And this is not a thing that's going to end overnight. All these stressors add up. And so we need to be prepared and have the infrastructure out there to handle recovery. And the message that I have for policymakers and the recovery community is we are the best and untapped resource that there is. People with lived experience, we know how to support each other, and actually helping other people helps us stay in recovery. So the greatest untapped resource that government is not utilizing is the recovery community of Pennsylvania. So I'll stop there.
Yeah, I think that, the first thing I did when this really, I figured out like how bad this was, one of the first things I did was call Bill. And I said, Bill, what should we be doing? And called other advocates and said, what is it you think, really across the country? And we just, we were pretty sure that, overdoses were going to go up right away. And we started advocating at the state level for an expanded distribution of naloxone. Naloxone cannot be sitting in a warehouse somewhere in Harrisburg while people need it. And that was a big success, being able to get that naloxone, being able to get the word out there. And we worked with municipalities to promote things like, neverusealone.com, which is a resource where somebody could call somebody if they're using drugs and really navigate, like, what's happening. If I overdose, this is what I want to happen. We also put a lot of information about, for people who use drugs, how to stay safe during COVID-19, and really trying to support organizations like Prevention Point Philadelphia, Prevention Point Pittsburgh, all of our underground syringe service programs, making sure they have the information to educate the people they work with who use drugs on how to stay safe. But it's, it's not been great. I mean, we know that the overdoses are way up, right? We didn't reach a lot of people during COVID-19. There's been articles in, York, PA, about how overdoses are up. We're hearing all over the state, things are up. And I think our responsibility now is to prepare for that next wave.
Well, I guess I'll speak for Recovery Community Connection. We've been working to kind of get, ourselves as an organization better integrated into the community. And it seemed like COVID-19 kind of came in and, took away all that face-to-face interaction and the progress that we were making promoting recovery within our community. But it seemed like we were able to act pretty quickly and mobilize our supports via Zoom, getting information about mutual aid recovery supports to individuals via our Facebook page. One of the things that really was helpful for us was getting into reach our youth who are in a residential facility with our recovery supports. And we did that first via telephone and then transitioned to Zoom. So just continuing to overcome the barriers that, COVID-19 presented. It's been very challenging for us as an organization, but, following what other people were doing, other recovery organizations and other advocates, I think has been very helpful. And like Bill said, hanging together has really been kind of a big deal for all of us, because we kind of are learning from each other. Like, how can we do this? How can we reach people? Isolation, it can really impact individuals in recovery. And I like Zoom. A lot of people have, some thoughts about Zoom. I love it. I think it was one of the best resources that we had to stay connected during this pandemic. So that's all I have. Thanks.
All right. So I'll ask question number 2. What are some of the challenges that you anticipate moving forward? And how can we all collaborate to ensure that we are organizing as a united movement?
Any of the panelists can jump in. Did you hear the question?
Yeah, I had a mouthful of bacon. That's my bad. I mean, I think that, you know, we're in this time and space right now where people are talking about criminal justice reform. And, you know, recovery is criminal justice reform. Our issue is criminal justice reform. You know, I'm tired of our brothers and sisters going to jail because they got a problem with drugs and they can't afford a fancy lawyer or they don't know somebody. And I think, like, in this moment, kind of outside of COVID, you know, we need people to be more engaged than ever, because politicians at the local level, your municipality on the county level, county commissioners, and your state legislators, they're getting calls about, hey, we're not happy with the way police are responding. And they're not thinking about us. They're not thinking about drug and alcohol issues. They're not thinking about the war on drugs. And, you know, what people are marching about is failed drug policy, over policing in Black communities, and what that looks like in your community. And that's something we need to be talking about. And I think that's the biggest challenge, is how we insert ourselves in a conversation that's happening that isn't cognizant of us at all.
I'm there with Devin. I agree. I feel like that's an area, the criminal justice reform is an area that, you know, the recovery advocacy movement could really, you know, start unifying on. I mean, you look at individuals with substance use and mental health disorder that are on parole and probation, that are being incarcerated for the most menial things, like a hot urine, and they're going to jail instead of, you know, being kept in the community. I really feel strongly, I'm in strong agreement with Devin there, you know, especially, you know, with, you know, he's saying is Black African Americans are being incarcerated disproportionately. And it is, you know, a side effect of the war on drugs. And we really need to get together with that. That is big. It's everything. It's everything about recovery. It's everything about, you know, the problems with stigma. I'm there with you, Devin.
Thank you. And you know, so there's a lot on the table, and I agree with my with the other speakers here. And you know, so I've been doing this work since the 1980s, and you know, back in the 1980s, crack cocaine was hitting our communities big. I've worked actually my whole life in our public care system, and it's a lot of people who don't look like me, who were passing through our care systems. And can people hear me?
Yes.
Okay, good. I didn't. So you know, as the opioid epidemic hit, you know, we're out and talking to people, and I'm looking at people who don't look like me, and having to acknowledge that you know, we have billions of dollars flowing out from the federal government. None of those things happened until it started to impact people that look like me. Until it started to hit white suburban communities, nobody gave a shit about addiction. And I news for you that crack cocaine didn't go away. Other drug and alcohol use didn't go away. You know, we're actually in an era right now where if you have a drug and alcohol problem, you get your life back together and you go to get into this field, you may not be able to get a job working in the addiction field with a criminal background, which probably is one of the great qualifications for you to do this work if you pass through those systems and successfully got in the recovery. There's a lot of ridiculous things that need to be changed. What I'm most concerned about is that with all this money that's flowed out from the federal government, that it got spent quick. There was some requirements that the money get spent quick. And I don't think that they've done things that will sustain the kind of infrastructure we need to support recovery over the long term. And one of my biggest concerns is the way Congress works. They threw out a couple $2 billion and they're going to say, oh, you're fixed and we're on to the next issue. And why are you still here? So we are going to need to keep the issue on long-term recovery. And we are going to have to watch where that money went and how to avoid being co-opted by groups that may have a lot of money, because with all that big money, it didn't get to the recovery community. You know, a number of people on the call, we came together twice to meet with the state to talk about where we thought the recovery community thought were priorities for spending money, and they were in recovery community organizations, collegiate recovery, recovery high schools, making sure that that people's needs were met, safe housing. Those are the things that we identified. Most of the money that came out have not been spent on those, and I'm not sure that we had any impact, frankly, on where the money went, because it was government talking to government. That's unacceptable, because we need a care system that meets our needs. So as we're going around Pennsylvania and talking to people, what we have found makes sense to the most number of people is to support long-term recovery. And some of the people here hear this shtick. I'll keep it short, but we know from research that, well, for one thing, 7 days in a rehab, like Devin said, you're going to die if you have an opioid use disorder and you get out. We didn't do you any favors by giving you that. The minimum effective dose of any kind of care is 90 days. You don't have to. You don't get that. People do not get that. Why don't we get the minimum effective dose of care? And that's what we need to change. The reality is, when I hit 5 years of recovery, I had an 85% chance of staying in recovery for the rest of my life. That's what the research shows. So why aren't we developing our policies around how do we get the most Americans, everybody, not just ones that look like me, but everybody into recovery? And that does mean criminal justice reform. It also means access to care, and also means listening to the people affected. Because we have a condition where our government doesn't listen to us. You know, so I think we need to yell louder. And I think we need to make sure that we are supported with what serves our community. I am sick of watching people die. I've been watching people die for over 30 years, but I've also been watching people get better. And the other side of that message is that when we do get better, we do amazing things. We go from homelessness to PhD. I've seen that happen. It doesn't happen enough. We need to put more infrastructure to make those kind of things happen. But the reality is, we get out of the addiction cycle, and we do amazing things, not just to help ourselves, but to help our families and help our communities. And that's why, instead of handing us, little bits of things, the center focus of policy in Pennsylvania and beyond needs to be on supporting long-term recovery. And I'll shut up now.
Wow. Thank you, Bill. In the spirit of that second question, I want to just remind people, please post questions in the chat box. In the spirit of that second question, I'd like to welcome Ed Niger, lawyer to the Ad Hoc Committee of Personal Injury Victims in the Purdue bankruptcy case, for some comments moving forward. Ed?
Ed, you're on mute.
Oh. You're muted, Ed.
How's that?
That's good.
Okay.
Go ahead.
Sorry about that. My daughter's joining me on this, so she's doing her videos. First of all, thank you everyone for having me. As you may know, I am the attorney for the Ad Hoc Committee of Individual Victims in the Purdue Pharma bankruptcy. Do you hear me clearly? Do you hear the music? Baba Black Sheep?
The music.
We can all relate.
Okay.
Yeah, just go with it, brother. It is.
All right.
Yeah, it's okay. We used to that kind of stuff.
I'm kind
go
of
with
digging
it.
both of the music.
All right.
My theme song.
Good. Okay, good. So I'm the attorney for the Ad Hoc Victims Committee. We're about 12 members now, each of whom is on the ground, similar to many of you here, on the advocacy, education, recovery, reducing the stigma, helping families who have lost loved ones in the days, months, years after that horrible event. And together, this Ad Hoc Committee represents over 40,000 individual victims who have appeared in the bankruptcy and are being represented by counsel. The hope is that there will be many more than 40,000 who file claims in the bankruptcy. so that the individual victims have a strong voice in the case. And that voice, at least as the ad hoc committee is concerned, is saying two things. Number one, it's saying that Purdue has to give itself up and the Sackler family has to give themselves up, or at least give up their wealth, so that it goes to the people who need it. That brings me to the second part of what our collective voice says, and that is that the money that is given up by Purdue, by the Sacklers, should go to individual victims who have suffered direct harm from Purdue's products, and or organizations, community charitable organizations that those victims choose and support. Right now, all the money is slated to go to the states and municipalities that are also suing Purdue. It is our firm opinion, and this opinion may not be shared by everyone, and I don't begrudge that, but at least in my client base, it is our firm opinion that the states are the wrong entity and the municipalities are the wrong entities to get the money. They have a proven track record of not only not doing the right thing with the money, but doing the wrong thing with the money, if they do anything with the money at all. In all likelihood, it's just going to, go in a bank account somewhere and not really be used until the attorney general or the governor finds something that's politically useful for him or her to use to put it towards. As one example of that, we were negotiating a $200 million emergency relief fund, which the states absolutely blocked because the money wouldn't be going to them. As many of you know, someone dies of overdose every 14 seconds, and that was before COVID. I don't know what that number is after COVID, but I'm sure it's much more frequent. That money could and should have been put on the ground to organizations that are saving lives day in, day out. But because it wasn't politically expedient for the states and municipalities, and they couldn't figure out, their own internal issues, that money is staying in Purdue's bank account, the last place in the world where it should be, and is not going towards saving people on the ground. So those are the kinds of things we're fighting for. Just to give an update on the bankruptcy, the bankruptcy was filed about 10 months ago. There is a mediation that's taking place right now. It's a long and complex mediation with a whole bunch of parties involved. That process is taking longer than expected, although if you would have asked me, I would have told you that's something to be expected. There was a bar date, which is the last date an individual victim has, or any creditor has, to file a proof of claim against Purdue. If you don't file your claim by the bar date, you will be forever barred from receiving any recovery from Purdue. That was extended from the end of June to the end of July due to COVID. So if anyone does have any questions about the bankruptcy, how to file a claim, what it is we are fighting for and using our voice for, feel free to email me offline. I'm happy to talk to you. The other thing that I would tell the advocacy groups is that if you agree that the money should not go to the states, but rather the money should go to the individual victims and or organizations supported by the individual victims, then you should reach out to your representatives and make your voice heard. That's all I have, and I'm happy to answer any questions.
Thank you, Ed. I think Ryan wants to jump in for a second. Ryan Hampton just asked if he could get a minute to follow Ed before we jump to Garrett. Does Ryan have permissions?
Yeah, give me 2 seconds, and he will. Okay, Ryan, you're good. If you could
I hate to crash this party. It is a great party, and I hate to jump in, but I hear Ed Niger talk, and I hear you guys talk, and it gets me fired up. And I'm sitting here like writing a whole nother book in the chat, and I'm like, it'd just be easier for me to jump on for a second. I don't want to take up too much time, but I just wanted to cap on what Ed said, because myself and a few other members on this call worked very hard And by the way, if there's any media who are on this call, this is not for print, not for publication, completely off the record. This is just to the advocacy community. Worked incredibly hard on this $200 million emergency relief fund. It would have single-handedly been the largest investment ever into harm reduction and recovery community organizations, single investment that this country has ever seen. We came very, very far. It is still being worked on, but it was shelved as a result of your state your state representatives, being your attorneys general, who did not want to give control of the money over to community-based organizations. Every single dollar of that $200 million was going to go support harm reduction organizations, community-based organizations, recovery community organizations, RCOs, many of which are in the state of Pennsylvania. And nothing has made me more open-eyed in terms of the problems that we face. And so I had to follow this up because Recovery Advocacy Project in Pennsylvania is doing a lot of great work. Johnny's doing a lot of great work. Devin is doing a lot of great work. Bill is doing a lot of great work. Jennifer, everybody who is on this call, the next year around this opioid litigation in general, all the opioid litigation, but specifically around this Purdue bankruptcy, because it is our best shot at getting money, not just to individual victims who have been harmed, but to community-based organizations, is critical. And I was always of the thought of like standing on the sideline and like cheering on my state legislators because I thought they had my best interests at heart. And it has been a very quick education for me that in this process, legal process, we're really our only best advocates. These states are not necessarily advocating for what's best for us, and in certain cases are advocating for things that have an adverse effect on the recovery community, that will have an adverse effect on people who use drugs and who need help right now. So the more that you can get involved in this process in your state and in your local government, it is critical, because I will tell you one thing and then I will shut up, I promise. They are counting on you not to get involved. They are counting on it. They are counting on the fact that you are not going to stand up in your community and that you are not going to take them on, because that is what has happened in the past, and look at where we're at today. So thank you, Johnny, so much for giving me probably what turned out to be more 4 minutes, and I will shut up now and put myself back on mute and hand it over to you. Thank you all.
Thanks, Ryan. You asked me for 2 minutes. Am I going to say no? If you ask me for 10, I'm going to say yes. Because Ryan's voice is needed, and he definitely just reciprocated what has been said since the beginning of this. Is our voices need to rise up. We all have strong voices, and we need to collaborate together and work together for solutions. And I'm going to shut up and pass it to Garrett, so then we can get back to the panel.
Sure. Thanks, Johnny. And thanks, Ryan, for jumping in there. If I don't know you, my name's Garrett Haid. I'm a person in long-term recovery, and what that means for me is I have not felt it necessary to use drugs or alcohol, specifically opioids and heroin, since March 3rd, 2015. I am the co-founder of the Voices Project. I have the privilege of working with the Recovery Advocacy Project as an organizer, and also the honor, I would call it, to be a member of the ad hoc victims group representing the Purdue bankruptcy case. And it's that hat that I wanted to speak to everybody here today. Thank you to everybody who has spoken today on the panel and everybody who's participated. And I wanted Ed to be on because this bankruptcy case is extremely complicated. And it's just good to have legal representation to understand what's going on. So in light of we're hearing everything that Bill said and Johnny said and Devin said and Jennifer said and all these supports that are on the ground right now, I mean, historically, and Bill, you had said it so beautifully, like it's historically underfunded. The recovery community is not at the table, and we get, the pats on the heads and the placated talk from our politicians who say that they support these things, but their actions do not line up with their words. And as Ryan had just mentioned, and something I get to witness as part of this ad hoc committee, I walked into this thinking I was battling Purdue Pharma, that's who I was needing to raise my voice to and saying victims need to be heard. But we're literally fighting this on two fronts. You know, COVID-19 has just made this extremely more important because not only were this was going to happen anyway. They were going to tap this money. They did it with the tobacco settlements. And I don't know the exact number, but I think about 8% of that actually went to people who had lung, you know, the disabilities or diseases created by the tobacco industry. 8% of that money went to actually help those people. If we stand by on the sidelines, a much smaller amount of money is going to come out of this settlement, and they will do the same thing with that. They've already, I know in my state, they've already started pulling money, and they're looking at money from this bankruptcy to fill the gaps that COVID-19 has done. And like Ryan had beautifully said, if we are quiet, they will do this again, right? And this bankruptcy is a perfect opportunity for advocates and people on the ground to organize, because we have to do it at a state level. It is each of our state AGs and each of our state representatives who will control the money that's coming down. If we are not there, they will not put it to funding harm reduction services or peer recovery supports or recovery community organizations. It will go to the gaps that have been created by COVID-19. COVID-19 has also created a lot of gaps in the substance use and mental health areas. So why not fill those gaps? It is incredibly important for everybody on this call to reach out to your networks, to reach out to your representatives, ask them what their plans are, and you'll get the words. They have plans. They won't show them to you. They won't tell them to you. And if we're not at that table, you won't be involved in the process. So I strongly encourage everybody to get involved. And I'm going to tell you 2 ways that you can do that easily. We're part of Recovery Advocacy Project and a lot of the advocates who are involved. One way, and you do not need an attorney to do this, right? You can certainly, it's your option. You can file a claim. What that means, it doesn't just mean that you are entitled to personal compensation if you personally were affected by this company, but it also means that you have a vote in the restructuring of this company. One day, a ballot will be mailed to you. You will actually get to vote on where this company's restructures and their assets go. Plans are being developed where we do have allies on the official committee that are fighting for everything Ryan had just talked about. So if you were personally affected, file a claim with or without an attorney, because that claim equals a vote. The other thing, and I'm sure many of you have done this, but we have a letter that it's just a simple sign-on letter. It's a click of a button. It will go directly to your AG's email box, asking them and demanding them that they do the right thing with the money that they get from this bankruptcy. I'm going to put both of those information in the chat. You'll see Ed's information. You'll see the Prime Clerk email web link, and that's how you can file a claim if you don't want to do it through an attorney. And then you'll also see write the letter to your Attorney General. I thank you all for being on this call. I really encourage you, as COVID-19 and all these crises are combining, don't forget that we are also right now in a fight for billions of dollars. And if we're not vocal, that money will not go to the right places. We know that historically. So again, thank you all for being on this call. I hope we can do many more of these, and stay safe, stay healthy. Thank you.
Thanks, Garrett. Certainly a lot of information there, certainly a lot of things for people to digest. And but it's very important, as Garrett and Ryan both said, and the panelists before, being involved in this is so important. Getting your voice out there and being mobilized as a group, being, you know, we have so many different voices where we're over here yelling for this and yelling for that, but if we can come together on common issues, we can provide solutions for our communities. So I encourage you to get involved. Second, what we do now is I'm going to pass it over to Scott, who's been looking at your questions in the chat box, and Scott is going to read a question from our panel. Scott?
All right. The question from Robert Ashford, that's, if I'm following the question correctly, he's asking about what he's calling recovery identity as policy. So I'm thinking that he's asking if we have enough of a recovery footprint in our government in the first place. So, for instance, do we have anybody running on a platform that includes being recovery oriented?
I think it might be helpful to unmute Robert and let him.
Correct.
Yeah.
That'd be great.
I'm going to do that. I'm going to unmute Robert. And if anybody else has a question they'd like to ask, raise your hand if you know how to do that in the Zoom function. And please keep in mind that we might have a bunch, so try to not go on.
I think it's Alt-Y. And Robert, do not ask a 27-part question. I love you, dog, but easy on us.
I think it is a 27-part question.
It is.
You should be able to.
It's only a 26-part question. Thank you.
Hey.
So yeah, and while I think the interpretation of the question you were going is also a good question. Really, I'm interested in two things, not 27 parts. The first is, as we begin to mature as an advocacy movement, as a political movement, building constituencies across issues, the first question is, do we think there is enough raw base capacity that our single issue voters around a recovery identity, where it's the organizing paradigm as opposed to other forms of politics or identities, single issue voters, for instance, right? Is gun rights more of an important issue regardless of recovery identity? It's a thing or a concept I've been grappling with lately. And regardless of that answer, the second part is really just how do we begin? We talked about ending the drug war, but as we mature, same thread, how do we begin to adopt a more intersectional advocacy identity and platform that really widens our umbrella, assuming that the answer to the first question is no?
Can I just say really quick, because I actually have Robert, I should share this poll with you. I know it's not, and I don't think we've done the polling in Pennsylvania, but we wrapped some polling around this in the state of Nevada, right? And it showed, we have some detailed crosstabs on it, that 72% of voters in the state of Nevada were actually willing to vote for a candidate of a different party around addiction, recovery, criminal justice issues, right? So I think it's about actually broadening, we have to broaden the message, I think, first and foremost around what is a recovery voter. I think that there's been a lot of different people have different definitions of what a recovery voter looks like, right? So some people will see it as like prevention and education. Some people will see it as harm reduction. Some people will see it as criminal justice reform. Like we haven't very well defined as an advocacy movement what a recovery voter actually is. Once we do that, I think we are much further on our way. I don't believe that we're at a capacity place where we have built out the infrastructure to support a recovery voter, because I think that the recovery advocacy movement is where it was supposed to be, because it was so kind of, I mean, it was new to me because I was new in recovery, but it was really all built for the most part around kind of this C3 nonprofit structure, that didn't leave much room for like direct political action. I think for me, as where I got kind of frustrated within the recovery advocacy movement, was I was always brought on to like a stage for like a proclamation, and I'd get like a pat on the head or like show up at a town hall and would like have to play a part. Like rarely have we seen like recovery advocacy, the kind of movement as is get very disruptive on the other side of public officials. Like that's just something that is kind of new, I think, on a scalable level, right? We've been more in the agreeable phase with public officials. So there is data though, and I know you're a data guy, and I'd like to share that data with you, that supports that there is an interest in making it a single voter issue. But I think that the other thing that we have to consider though is like being a single voter issue around recovery also means that you support things like Medicaid, right? It means that you support things like the expansion of Medicaid and the expansion,
universal health care.
Some of the issues, healthcare, healthcare. I mean, like you can't be a single issue voter around recovery and then, say the hell with these other issues. So it's really an understanding in the definition of what a recovery voter is. And I think the other thing, and I'll just close on this, and again, sorry for hijacking this, but like Devin and I talked about it earlier today, the recovery advocacy movement, the recovery space is well positioned, I think, to take on a lot of these larger systemic issues that we're seeing play out all over the place, if only we could actually stick to like our recovery values and what they are on paper. You know, like we could look at what recovery values are on paper, and then people who like will say they support those values and want to live out those values aren't necessarily even representing them in their own advocacy. So like, it's kind of getting back to basics as a movement for us before we can take on those other bigger challenges of building that effective constituency of consequence.
Yes. So just to thank you, Ryan, I want to jump in and kind of give my thoughts on Robert's question. I think the first part of your question, the answer is no, right? I don't think that recovery identity is a coalesced enough idea. I know people in recovery that vote red. I know people in recovery that vote blue. And a lot of people say things like, you know, recovery's apolitical. It's not a political issue. You know, I don't want to get involved. A lot of people in recovery are very disengaged politically. And that's, you know, kind of a problem. You know, when we go through a 12 steps, we get this idea that I have to give back, that I have to be part of, but that's inside of the 12-step fellowship. And we really don't see that engagement on the bigger level. You know, when Ahmaud Arbery was shot, murdered, lynched by a police officer, his mother didn't have an option whether or not she was going to be a public figure, right? And when people die of opioids, they are self-select into silence, where they say, my son and daughter died in their sleep, which is code for overdose. And until we create space and really engage people that they can feel comfortable talking about overdose, it's going to be very hard for that to be an identity. And whether that's overdose, criminal justice reform, because we know it's intersectional. And really the second part of your question, until the recovery advocacy movement becomes more intersectional and grows, and really, like Ryan says, is afraid to not be political. Like, you know, there are only 2 501c4, which are nonprofit organizations that can be really political in our entire space. If you look at the reproductive justice movement, they are just chock full of political giving. You know, Planned Parenthood, these organizations have power, they raise a lot of money, and we're just not doing that, right? We're not engaging in the heavy politics for whatever reason, or for lots of reasons, and I think that's a problem. We need to do more.
It's just fascinating though too, because it's like, you can, when you have the political discussion with a recovery person, like I just put in the chat, like recovery as a concept is not political, right? But access to recovery services, access to all of the services that you need for recovery, healthcare, those are very political issues that require political action, right? And so that's kind of where we're missing the mark. And I'll have a conversation with a voter around recovery who's like, of course I support recovery, but again, it's back to the definition. Well, do you know that, you know, if you're, you know, supporting candidates who want to, you know, cut back, you know, Medicaid, don't support Medicaid expansion, XYZ, then you're kind of in conflict with supporting recovery, you know, because those are necessary. So it's a multi-step process, and we're just not there yet, you know, but I think we can get there.
So let me just jump in for a second here. And I would say to Robert's question, no. And I think I lean along the way that Ryan is talking about. This is nuanced. And so, you know, if we start to develop, why will people vote with focused on recovery? And I think it differs from group to group, and we need to learn more about that. So, like, we know that the opioid epidemic has affected the GDP by 3%. I mean, the opioid epidemic alone has cost 3% of everything we produce in the United States. We know that alcohol use disorders cost more than that. So if we start to talk about things like that, and that if you want to solve our healthcare crisis, we have to get serious about treating and getting people into recovery from addiction. The criminal justice system is another element that's just driving costs, and we end up with people with high ACEs score or his trauma that goes from generation to generation. We have to arrest these cycles, and I think that the nuanced message is actually we have to get serious about messaging for different groups, so we actually build that that large tent of individuals and organizations should say, yes, supporting this makes sense for America, even if we don't give a shit about recovery. And frankly, there are a lot of people out there that don't care if we live or die. And we have to accept that and also figure out, even if they don't care if we live or die, how do we message them so they support our issue? And then it becomes very political. And I agree with Ryan, it's not, recovery isn't a political thing, but when you start to try to move this forward, you have to think politically to do it.
Yeah, I mean, I think that, and again, I just want to jump in one more time. I agree that recovery is not a political thing. It's easy to support recovery. And so we've got politicians who are saying, I support recovery, but you know, just like saying we can't arrest our way out of it, but they refuse to repeal any of the laws that were designed to do that, right? And I think that, you know, we saw in 2016 when Bernie Sanders was running and he was talking about access to healthcare, and I watched my peers in recovery being like, Bernie's crazy, or, you know, Obamacare's bad. And I was like hurt. I was like, what are you talking about? Like, I got a recovery because, you know, so many of my friends got a recovery because they had access to insurance because they were on their parents' healthcare. So I think it's about becoming an informed citizen on political issues and then pushing back on your peers, not just being an advocate and talking to legislators. We got to change the culture.
Thanks, Devin. And I want to jump in and kind of, you know, there's I guess play the devil's advocate, you know, as an RCO or you know, any other recovery-oriented organization, you know, there's always that, you know, that place where, you know, we start advocating for these issues, you know, with the politicians and legislators, and, you know, we tend to look at it as, you know, we don't want to put ourselves at risk of being exploited for someone to get political gain. And, you know, even as an RCO, looking at our board members, we're always very careful about, okay, is this a position that someone is going to exploit our organization for, you know, political gain or some kind of notoriety? And then at the end of the day, they've left us hanging on the issues that we are working so hard to champion. So, and I think it's important for all of us, you know, I agree, there could be some unity, you know, but there's always that, that fear that, and I don't want to live in fear, and I know none of us do, but, you know, that, you know, we could potentially be exploited as a group, as a movement, and we don't need that.
I just want to say the exploitation around recovery issues is intense and widespread by politicians. I see it happening every single day. People who say they care about us, people who say they care about these services, they think that the war on drugs is obsolete and needs to be reversed. And then you look at their voting records and where they're putting, I think a big determinant too is how they're allocating money, and putting money on the ground is another determinant of it as well. And there is a fix to it. I mean, every movement, you know, and particularly as a gay man, you know, and have studied, you know, at length the LGBTQ movement, at some point, a whole group of us, people who are on this call that I'm looking at, and I'm seeing all these squares and faces in here, you know, you all should be taking these people's jobs. You know, like there are people out there in different states who should be running, and we see it happening for county commission, you know, city council, state legislature, Congress, whatever it may be. Like, you know, we've got to start getting a little bit more involved, but we've got to lay the groundwork first.
Can we ask another question? Can we get a softball, an easy one? What do y'all got? Come on now. No more Robert. Don't ask. If Robert asks another question, you ignore it.
Yeah, we are approaching 20 minutes after the hour. So if someone has a question, please raise your hand. Feel free to jump in as we get ready to have some final thoughts from our panelists moving forward and closing out.
Yeah, all right. I got a question for the panel. How do you respond when science and evidence back something up, but legislators still won't embrace it? How do we respond to that as panelists, whether it's RCOs, Naloxone recovery high schools? How do you not go crazy when that happens?
Try.
Yeah, that's something that happens across multiple spaces. I mean, think about climate change or other things like that. So, unfortunately, I think we have to sometimes accept that, that people may not accept factual things and figure out how we still get things done. I mean, that's the bottom line. That's how politics work. And I think we need to do that in ways that actually bring people together, because we're in a long game here. And we will be for a while. So we need to actually build coalition rather than focus on narrow issues and jam them through. So my opinion is, if somebody doesn't believe in the facts as we know them, we still have to figure out ways to bring them on board, or if they simply won't get out of our way, move around them, but also bring people along the way. That takes some subtlety, and that takes some effort, and sometimes you got to hold your tongue.
Absolutely. All right, well, I'm not seeing any hands raised, so I would just ask the panelists as we're closing out if they have any final thoughts to kind of offer to the group, solutions, things that came up that kind of tricked your trade. And Devin's shaking his head, so I'll see Devin, go ahead.
Yeah, I just think that we all have to become more engaged, right? If you think about, what's happening at this moment in time, our class consciousness is raised, who's really on our team and who isn't on our team. We saw the banks get billions of dollars. Why I just got a check for $1,200 like 2 weeks ago. Who has the power and who doesn't have the power? I mean, we're the ones who have the power. People look at these protests and like they're not going to get anything, this, that, and the other thing. We saw changes in the police budget in Philadelphia. We're seeing real change in Harrisburg. When we get engaged and we get out there and we use our voices together, we can have great impact. If we look at the civil rights movement, if we look at the LGBT movement, look at the women's suffrage movement, people took to the streets, and that's the level of commitment it takes. And you just got to decide how much you give a fuck about this. Do you want your friends to have a real chance to survive that use drugs or not? And like, either way, it's cool with me because this is my whole life. And I'm not saying it's got to be your whole life. I'm just saying you could do a little bit more. You don't have to be a wackadoo like me and Bill and have this be your whole career. You may be able to make more money, do something else, but I'm damn sure that some of y'all could do more. And I think you should take one of these organizations and start volunteering. Pro A is a great organization. The things that Johnny Fabs are doing is great. And I think obviously that we're doing amazing work. And, just get out there, get involved, take to the streets.
Thanks,
Devin. And can I just say something I would think about it, and I'm going to try to put this in I'm going to see if I could put this into words. So I'm in recovery for over 3 decades, and I think the first couple times that I was accepted to sit at a table with policymakers, I was just honored to be there, and I was quiet, and I think a lot of times, we talk about stigma, but there's different types of stigma, and one stigma that we have to come to terms with is internalized stigma. And it could be one of the hardest ones to identify. And that's actually where, even though we're talking about how recovery is great and we are worthy, at some point, some of us, and I will say for myself, there are times when I thought, well, maybe I'm really not that good. So looking back, and it took a non-recovering friend of mine to point this out to me, somebody who had been watching it for years along a lot of people, is sometimes we have to look at our own internalized stigma and say, damn it, we are worth it, and damn it, we better stand up. And sometimes we're the ones that are holding ourselves back. Like, we've internalized that stigma against us that we're not worthy. And I'm not sure exactly how we get over it. And I'm not saying everybody on here has that, but I'm saying it's a real thing. And that's also what we have to start talking about.
Thank you, Bill. Thank you. Jen, any final words?
I do. Since we have Robert Ashford here, some representation from Unity Recovery, I just want to give a shout out because the All Recovery platform is phenomenal. It is everything that I think many of us have been praying for in regards to having that that connection. And I've joined several of the All Recovery meetings, and I thought they were just amazing. It just, you know, we started some All Recovery meetings at RCC, and I thoroughly am thankful for that we connect. So thank you.
Thanks, Jennifer.
Shout out.
Good shout out. I just want to say that, you know, what Bill just said, it was the first time that I had the opportunity to sit down at a table. It was freezing cold, the middle of winter, drove to Harrisburg on my own dime to go sit at a table with Devin, Bill, and Jennifer to talk about the legislators about how we could utilize money in our ERs to help implement warm handoffs programs. You know, something that was earmarked for could be used for peer support, and rather than has to be used for peer support. And I remember sitting at that table, and I remember the feeling I had the night I graduated from treatment court. And there was an individual that was, you know, that pat on the back, here's that little plaque and that platform, and look how good Johnny's doing. And as I walked off the stage, I was turning the other way, and I heard the individual talking to the other officials, and he said, yeah, that's something that's good about his recovery. Yeah, absolutely. But I'm not inviting him over the house next week, if you know what I mean. And they all laughed. And, you know, that was kind of the first time in recovery that I had experienced that. And when I sat at that table, I had that same fear. So I think that the more that our voices are amplified, the more that we get out and challenge that, you know, I still have it today. You know, speaking in front of you guys, I still have that feeling that somehow that, you know, I'm being stigmatized or I'm being judged for my voice. And I want to thank you for pointing that out, you guys, because it stirred something in me, because that is the reason that my passion is there. That is the reason. That's the core reason of it now. And yeah, well, I'm not going to get emotional. I'm going to close it out here and say, once again, on behalf of the Pennsylvania Recovery Advocacy Project, thank you to all the participants for joining in this conversation this evening. Thank you to our panelists for your continued stewardship of the movement. We amplify our voices in collaboration and partnership. We mobilize by working together and supporting one another. And we create change by being resilient and determined. During COVID-19, a saying became viral that it is one that you may all have heard. It is, we're in this together. As a movement, it is imperative that we unify in a time of great need. Once again, we thank you for attending tonight, and look forward to assisting your organizations and working together in the future in any way possible. So get involved. You know, go to recoveryvoices.com, like our Facebook page, Pennsylvania Recovers, and get involved. And thank you all for being here tonight.
Thank you.